President-elect Joe Biden got his first dose of the Pfizer coronavirus vaccine today, live on television. Well, here in New York, healthcare workers started getting the second approved vaccine. That's the one from Moderna. And there's a lot of optimism in the air around the vaccine as we got two now circulating. It was tempered, I got to say, for me, by news out of England, where an apparently highly contagious new strain of the virus helped nearly double the rate of infections there in the past couple of weeks. Question now, so how worried should we be about this new strain? And also, the vaccine is still going to protect us from that, right? There's perhaps no one I'd rather talk to right now to help answer some of those questions than Pulitzer Prize-winning science writer Laurie Garrett, columnist at Foreign Policy magazine and author of The Coming Plague, Newly Emerging Diseases in a World Out of Balance. All right, Laurie, let's start with the mutation that is in the UK. Is it real? And do we know that it is contributing to a much higher rate of transmission?
So, Chris, I have to give you very bad news. This is the fourth mutation event that is significant, apparently, in the transmission of the virus. The first big mutational event occurred after the virus jumped to Italy sometime in February or March. And it was that very transmissible strain that made its way to New York and the East Coast of the United States. The second mutational event occurred this summer when the virus somehow got into mink in mink farms. This is the animal that makes fur coats in Denmark and elsewhere, and now also in mink populations in North America. And that strain can spread to people from minks. It's not clear whether it goes from people to minks, but presumably that's how it originally got in the mink population. The third one appeared in October in South Africa, and it is a significant change. It seems to make the virus more transmissible, and there are some indications from the South African Ministry of Health just today that it may also be more virulent in young adults. It's spreading faster in younger adults, and it seems to cause more severe disease in younger adults. And then we have the British one, which was first noticed apparently in September. It has really swept the UK over the last 3 weeks. It now accounts for about 40% roughly of new cases in the UK and seems to be about 71% more transmissible from person to person compared to the routine strains of COVID-19 or SARS-CoV-2. So, yeah, there's a lot to think about here. Are we looking at something that's more dangerous? If these estimates of its rate of reproduction hold up, and it's now several different laboratories and research organizations confirming what the British originally said, that their strain is reproducing much faster, log scale faster than the routine spread COVID strains. If that holds up, then we may or may not be looking at a more virulent strain, but we're certainly looking at a faster spreading strain. One set of studies seem to indicate that once people are infected, their bodies actually start producing far more virus, at least a log scale more virus. And so they're shedding more virus. They're more likely to be infectious to people around them.
So this is just a graphic that sort of gives you a sense of how this has happened in the UK. This chart shows sort of how over time this strain has become more and more dominant. You see that the prevalence of that orange variant growing over time. So then the big question becomes the vaccine, right? So my understanding from the reporting that I've done over these last few months and talking to virologists, right, is that this coronavirus is relative to, say, flu is fairly stable. And that has been useful in sort of designing the vaccine. We've already started to see mutations. What do we think that portends for the vaccine?
Right now, the general statement that's being made by all parties associated with health departments and so on is looks like the vaccine will be fine and this is going to work out just fine. But we don't actually have data one way or the other to answer that question. It is interesting that the UK studies on using the routine nucleic acid tests that a lot of places are using to see whether or not you're infected are missing this new virus if they are tests that target the so-called S protein, which is the spike that you see sticking up out of all the little this sort of ball-shaped virus with these little spikes sticking out. And that S protein is the key mutational event that seems to make this more transmissible, because that protein is what logs onto a human cell and then opens a door, and then the virus goes into your cell. Well, it's also what your antibodies recognize. And, it does appear that at least those kind of PCR tests that specifically target finding that S protein are missing a lot of the English infections. And they are advising that you use a broader PCR analysis that looks for more elements of the virus. And that, that's a little disturbing.